thank Jyotidev and his whole team for this whole conference and for inviting all of us here. And I think this is something that they've been doing for a long, long time, and I hope that it succeeds and carries on. I'm not going to take too much more of your time because I think you will have to sit and listen to me right after this. So I'm not going to repeat anything, except one thing let me tell you about when I was sitting here, Sunita's father came and met me and sat with me. And when I went out, I told Sunita, I said, how come you don't look after me? She said, no, I told my father to do it. You old people must stay together. So I have no other thing to say about it. She's ignoring me right now. Sunita, you're ignoring me. I hope you know that. Yeah. In any case, again, Jyotidev, thank you very much. And let's take things further. At the same time, as I will say in my lecture next, I think we need to sit back and think whether what we are doing and all this education that we are spreading is the correct education or not. Because is it really making a difference in the lives of our people with diabetes? To be very frank with you, the answer is no. If this is a war against diabetes, let me tell you, in India at least, we are losing it. And I think we need to sit back, all of us, and think as to why we are not making a difference in diabetes. I'm not going to say anything more right now, but hope we'll cover a lot of these points later. These are things that don't go down well with a lot of doctors, but some things have to be said, and well, they will be said by me, because I've reached a stage where, frankly, I speak what I think, and if people don't like it, then they can discuss with me, argue with me, but that doesn't mean I'm going to stay quiet and just listen to everything else. We have a school of diabetes, which the Diabetes India has started, and slowly, in November, the International Diabetes Federation will start a school of diabetes. And what it will do is there'll be a lot of open access material for education, but there'll be 3 certified courses, one for diabetes and nurse educators, one for primary care physicians and general physicians, and one for specialists. And the reason, I will talk in my speech, but I will ask you one simple thing. In 2011, forget the past before that. In 2011, when the International Diabetes Federation came out with its atlas, there were a lot of beautiful figures and a lot of data and everything else. But one of the things that we realized was that one person dies because of diabetes-related complications every 7 seconds in this world. Last year, when we came out with our latest atlas, what did we find? Yes, the numbers had gone up, a lot of data was there, but one person died every 6 seconds. Now, I ask all of you, there are people here who dance around attending conferences and lectures and giving lectures everywhere. A lot of new guidelines have come in. We saw a lot of them right now, this and that and this and that. New medications have come out. And yet, what is the use of all that? If for the people with diabetes, their life is becoming worse. So I think time for us to sit back and think as to what we are doing. And one of the things we are going to focus on is educating the right way, educating the correct people, and educating in a non-generic, unbiased manner. I am not a person who will allow either the Diabetes India or International Diabetes Federation to make claims about some things which have no relevance. It has to be something that can be used on a day-to-day practice. And hopefully, we will be able to make a change. And I really would like you all to be a part of this, be a part of faculty, be a part of coordinators, and to tell people to go through that and see. Because it is only by educating, it is only by empowering the people who are the real people who will make a difference, will we be able to do something about this diabetes tsunami. Otherwise, we will meet here 10 years down the line and say, well, one person dies every 2 seconds in the world. Very frankly, when I say 7 seconds, remember, it's 10 minutes in the United States, It's 4 minutes in Western Europe. So if you take that into consideration, it is almost one person every second in India, China, Africa, everywhere else. So you can see how bad things are. And I think it's time for us to realize that we are not here to live in our academic towers and say that, oh, I know everything. I'm fantastic. If we are not able to help the people. And why the focus is on primary care physicians, I will explain in my talk. But I sincerely hope that this is something that hopefully is not going to cure the problem of diabetes. It's not going to happen, no matter what anybody says. But at least we have to, if there is a tsunami of diabetes, we've got to have a wall which stands by. And I think education is going to be one aspect of that. Thank you very much.
Respected Dr. Shaukat M. Sadikor, the President of IDF, Dr. Saadullah, Dr. Manojan, Dr. Srijithan Kumar, Dr. Jyoti Dev, Sunitha Jyoti Dev, Dr. Arun Shankar, Gopika Krishnan, and Dr. Ashwin David, respected faculty from wide and far, from state and outside, and also from outside the country. Dear participants, Dr. Jyoti Dev, who is an alumni of Trivandrum Medical College and a former faculty there, has invited me on one purpose, that in Trivandrum, an alumni of Trivandrum Medical College can organize, successfully conduct, propagate the health education messages of preventing diabetes, treatment and care, and also year after year, from a state level conference or a workshop to an international one, so that it will be an example for the students and other faculty in our college. And I hope that he has succeeded in this. I take this opportunity to congratulate Dr. Jyoti and his team, who has made it a point that this happens every year, increasing the horizons and also bringing to us all the latest in diabetes prevention and care. And with the support of Dr. Srijit and other experts in the field in the hometown, and the mentorship of Dr. Shaukat and others from outside, we have made a difference. He had made a difference and he will make a difference. And we, the faculty and the students of Trivandrum Medical College, express our sincere appreciation for this workshop, which will help to broaden our vision, our knowledge, our expertise in diabetes care. Thank you for this opportunity and all the best for this conference. Thank you very much.
Thank you, sir.
Respected President IDF, respected Dr. Saadullah, respected Dr. Thomas Matthew, Principal, Trivandrum Medical College, respected Dr. Jyoti Dev, Mrs. Jyoti Dev, other dignitaries, ladies and gentlemen, good evening to one and all. At the outset, let me thank Dr. Jyoti Dev for inviting me for this conference. In fact, being a medical administrator or a chief executive of a hospital or a medical institution, my concern is whatever the scientific knowledge you gained from this conference, tomorrow it should be useful for the society, especially common people of this country. As you all know that any doctor, immediately after passing MBBS, they think that they can treat diabetes. I don't think that is the right way to deal diabetes. I realized this when I met Dr. Jyoti Dev and when I gone to his or visited his hospital. There are so much things are happening in the world of diabetes. Dr. Srijit is here, who knows very well about that. And day in and out, he talk about diabetes even in IMA. So what is required is there are right people to treat diabetes. We should be a little more generous to direct them to the right people to manage diabetes, so that, as it was mentioned earlier, that our state is the capital of diabetes. I am not sure whether that is correct or wrong, but the fact being, we have plenty of patients who are coming with diabetes even in our hospital. So I think we need much more trained and focused doctors in the management of diabetes. And I'm sure Jyoti Dev is a very promising team is there, and in near future we can expect the proper answer for diabetes, and we can cut down the cost involved in the management of diabetes. I once again congratulate and thank Dr. Jyoti Dev for his effort in creating awareness about how to manage diabetes properly. Thank you.
Hi, good afternoon to all of you. Dr. Jyoti Dev, I really want to congratulate him for taking this as a real effort and to make the awareness as well as the workshop. Probably should be useful not only for the doctors, also for the public. And Dr. Shaukat Shadikot, the president of the IDEA, stressed on the importance and also inaugurated this session. Dr. Manoj and Dr. Srijitan Kumar and Dr. Thomas Matthew, my colleague in alumni, as well as principal of Trivandrum Medical College. Ladies and gentlemen, I'm honored. I'm very happy to be here among you. I'm an internist by profession, even though today I manage a big corporate in Kerala, 1,750 beds. But I started as a clinician and went around in the world, and one of my passion was in diabetes, and perhaps that may be the reason Jyoti Dev invited me. Just a couple of points. I heard somebody saying that Trivandrum is the diabetic capital. And usually I travel around, we have got several institutions in the GCC. When I go to Bahrain, they say that is the diabetic capital. And when I go to Oman in Muscat, in many settings, they claim that that is their diabetic capital. So now we claim that Kerala is the diabetic capital or Trivandrum is the diabetic capital. So the good thing about is that the stigma associated with diabetes has completely gone. And certainly now people accept it as a lifestyle change, and people are willing to talk about it. I worked in a company called Aramco in Saudi Arabia about several years. And about 35 years, probably the first diabetic clinic in Saudi Arabia, we started there. We have a big hospital facility, and that is how I got involved with the diabetes. In connection with that, to start the clinic and to study it, I went to Jocelyn's Diabetic Center. They have got a few centers in Harvard, Mayo, and as well as in Florida. I was in Florida. And even that time, we were talking about hemoglobin A1C as the gold standard. In our country, still, it has not become our gold standard in the management. And I think there's a lot of educational awareness, teaching to the public is required to make that as the gold standard, and also the home glucose monitoring. The diabetic clinics at that time, many managers, vice presidents and all come to my diabetic clinic. And one of the vice presidents told me that I was sitting outside your office, and then one of the employees who is an operator or somebody lower down working with him came and told him, "Oh my God, sir, you also have diabetes? I am also waiting here." So that was a stigma at that time. So he advised me, I think for us there should be a separate waiting room. So we have to give a separate waiting room for the VIPs, like the VIPs of our political system. But certainly today, I think we are all talking about diabetes in a very, very democratic way and in a very lighter manner. And that is a great thing. And that itself is a improvement in the awareness. And the recognition is as a lifestyle disease is another second point we all should look at. And, we can have so many theories of, inheritance and, as well as viral and so many infection theories. All that theories are still there. But nevertheless, the most important factor is that it's a lifestyle disease. And so how we can change our lifestyle to really deal with it, or at least postpone the occurrence of the disease by itself. And thirdly, we have to look at the complications, and if we treat it properly, whether we can deal with the complications. And no doubt that Srijit Kumar and Jyoti Dev and all the other diabetic experts will say that, certainly it is possible. And so that the quality of life is what we are always looking for, and that can be definitely met to our satisfaction. The private sector is playing a major role in the control of 60 to 70% of the diabetes is controlled by the private sector today in Kerala as well as in India. I know that the government sector has tried in here with the various outside agencies to start a diabetic center, etc. in Trivandrum, and the story is very well known to the public. So certainly, I think people have to understand that the private sector can play a great role, but it should be an inclusive growth. It should be an affordable care, and that is where the doctor's role come in. So let us all look forward to whatever deliberations is going to happen today and tomorrow, and whether it is useful for the public outside or the common man outside as an affordable care is the question we have to look at it. And I hope that is the way the experts here are going to talk about it. And I wish you all the best in the coming, today's lesson deliberations as well as tomorrow's scientific sessions, and wish you all the best and enjoy the rest of the conference. Thank you.
Respected President of International Diabetes Federation, Dr. Sadikot, my dear friend, Dr. Jyoti Dev, Sahadullah sir, Manojan sir, Thomas sir, all big stalwarts of Trivandrum, the icons of Trivandrum. It's indeed a great occasion, very great occasion. In fact, I was requesting Jyoti that I'll not speak again because whatever I had to say, I had already told when I was giving that lecture. But still, it's a great pleasure. It's a great pleasure. We all feel so very proud that Dr. Jyoti Dev, from an alumni of Trivandrum Medical College, has grown to the status of an international academician. In the field of diabetes, he keeps going everywhere. He presents paper. As our Honorable Parliament Member Dr. Shashi Tharoor told, he keeps both interests in clinics, research, but I think his passion is education. And I think what Jyoti is getting out of all these exercises, he conducts this passionately. Let it be a patient education, let it be such education. Apart from all the glamour and glitter, I think at the end of the day, Jyoti is passionate about of educating. And right now, I'm sure what is going through his mind is about the next program which he is going to conduct maybe tomorrow or day after. That's the enthusiasm and the passion with which he conducts education. And no wonder he is associated with Dr. Sadikot. Sadikot, who in his lecture, I've heard his lecture numerous times. He doesn't know me, but I know him. Just like Amitabh Bachchan doesn't know me, but I know Amitabh Bachchan. He's the Amitabh Bachchan. He's the angry young man. Today, Sunita told that he's a little old, but then still I remember him as the angry young man in diabetes. He's always rebellious, not against anyone, but against the gross morbidity and mortality which diabetes is claiming. And his lecture is going to be an eye-opener. In fact, I had hosted him around 4-5 years back in Kottayam. I don't know whether he remembers that lecture, but it's going to, and such is a man who should become the president of the International Diabetes Federation, because diabetes is not something which is going to be discussed in Taj, Vivanta, and, Sheratons and Oberois, but it's something which we are battling it out on ground with, as Dr. Tharoor told, our poor patients who just cannot afford anything. And Indian Medical Association over the last 3 years has drawn a clear line, a pro-people line in Kerala. And I'm extremely thankful to Dr. Jyoti Dev, because when we launched the Patient Care Fund, a program which was aimed at mobilizing contributions from doctors and using it to serve the poor people. There were many who politically opposed that, even now they do. But Jyoti was one person who immediately called me and told that, Srijit, whatever is the Patient Care Fund, I'm going to donate for you. And he is one of the first persons who donated 1 lakh rupee to the fund. And Sunita received the Golden Care honor from the Chief Minister. It was a huge honor for Indian Medical Association. So on behalf of IMA, which I am representing here, I assure Dr. Jyoti Dev that we'll be associating with all your educational programs. And I assure Sadikot sir that we'll take up your dream of education and more education, and we'll see to it that the poorest of the poor stand to benefit from all our education and academic activities which are going on here. I wish the conference all the very best, and once again tell Jyoti that how proud we are of you, and wish that all of us together, all the iconic leaders of Trivandrum and in the field of medicine, join together to see that our country, not just our country, he is president of International Diabetes Federation, but we are more concerned about our country. Our country certainly win the battle against diabetes. Thank you. Jai Hind.